We're living in a really scary time post-Dobbs. Since the fall of Roe and the ability of states to impose new restrictions, about a third of women and girls of reproductive age now live in a state with either a near total abortion ban or with restrictions on abortion in the first trimester of pregnancy. And that's really scary for people who may have an unintended pregnancy. It's also scary for people who have wanted pregnancies and something goes wrong or who experience miscarriage or stillbirth. So it's really a scary time, I think, to be pregnant in a lot of the country. And at the same time, post-Dobbs, we've also seen some real innovation, both in the law and in service delivery, and specifically around shield law provision. So although we're in a more restrictive legal environment in much of the country, medication abortion care through telemedicine is now available in all 50 states. The phrase I like to use is MIFI in all 50. And so abortion seekers in any part of the United States can now use our service and others to obtain FDA-approved medication abortion pills sent to their home. Well, the most recent numbers suggest that about 1 in 4 abortions are actually through telemedicine. So it's becoming a critical part of the abortion care landscape. And almost all of the abortions that are taking place in states with near total bans are taking place through shield law provision and through telemedicine. And so we know that this is a lifeline for a lot of people. There are still many people in states with near total bans who are traveling outside of the state, traveling across state lines to get abortion care from brick and mortar clinics. But increasingly, we're seeing people make the decision to have their care closer to home, often at home. And what we know about telemedicine medication abortion care is that it's as safe and effective as medication abortion care that's provided in person through a brick and mortar clinic, and it's highly acceptable to patients. I think there's a number of things that are happening. First, with MAP and other shield law services, we have really tried to create models of care that are affordable. And so by increasing the affordability of abortion care, we've increased the accessibility of that care. And so we offer care at the MAP we use a pay as much as you can model, and we trust that patients will pay what they can pay, but we offer our care for $5 or more. So that actually has had a tremendous impact in expanding access. But another strategy that is so exciting is this idea of uh, getting pills in advance of need, so what we call advanced provision. And right now, we care for about 2,500 patients a month. A third of our patients are from Texas, 95% of our patients are from states with ban and restrictions, and somewhere between 1 and 5% of our patients each month actually aren't pregnant, but are getting pills just in case. And so those future use patients, I think, are really thinking about a different kind of strategy. What does it mean to have these pills on hand? The patient still has clinician support and always can come back to us for support if and when the patient uses the pills. I think that's a pretty critical strategy right now for enabling folks to have control over their reproductive lives. Well, of course, the Dobbs decision is devastating in what we're seeing around the country in terms of new laws that are being proposed, that are making their way through state legislatures, the lawsuits against shield law providers, either criminal or civil. All of this is really scary. So we need to work proactively on legislation to ensure or shore up abortion rights in those states that have them. But I guess the one thing that I would say is that medication abortion pills are here to stay. Like you cannot put this genie back in the bottle. And the anti-abortion rights movement is really focusing right now on trying to do everything they can to restrict access to medication abortion pills, whether that's mifepristone or mifepristone and misoprostol. And they're trying a lot of strategies right now, but I think it's clear that even if some of those strategies are successful, there's other ways that pills are going to come into the United States through community networks, through international providers. These pills are safe and effective. They work. People need abortion care. And so I think we will see this landscape continue to change and evolve to meet whatever legal challenges arise.